A background about me. I've spent 16 years in healthcare policy at the federal level, analyzing Medicare and even Medicaid. And I even teach a course on healthcare policy and have done so for 5 or 6 years. And this is my first term in the Virginia General Assembly. I've now had a year to really analyze the Medicaid budget. I've done it from the perspective as a delegate, as a member of the Health, Welfare, and Institutions Committee, and also as a member of the Virginia Health Reform Initiative, the governor's task force to look at the implementation and improvement of Medicaid. And during that time, I've had a chance to take a hard look at our Medicaid program, and the statistics are very staggering. Virginia's Medicaid program is facing a fiscal crisis. The budget is on an unsustainable course to bankrupt our Commonwealth unless we are willing to take bold and decisive action to preserve and protect the Medicaid program for future generations. Here are the facts. Virginia's Medicaid budget has grown by a staggering 1,600% in the last 27 years. It's going like this if you're looking at a chart. Medicaid represented 5% of our budget in fiscal year 1985. It is now over 21% of our entire Virginia budget in fiscal year 2012. Reimbursement for hospitals and doctors is scheduled to go from 72 cents on the dollar last year to nearly 64 cents in fiscal year 2012. Doctors are being forced to turn away patients because they can't afford to provide the patient care and still keep their doors open to operate. And we continue this antiquated policy that emphasizes expensive institutional care instead of less costly home and community-based care. All this adds up to decreased access, costly ER visits, avoidable hospitalizations, and paying for expensive services for individuals with intellectual disabilities and developmental disabilities when similar services can be provided in the community at a lesser cost. My proposal will chart Medicaid on a course that will slow its growth and save taxpayers money. Let me repeat that. If we go on the direction, we continue going in the same direction we're going to keep going up and up and up and up. My proposal will slow that growth and it will save taxpayers money. My proposal will designate $254 million that will nearly eliminate the Medicaid waiver waiting list. And you got to remember, when we use Medicaid dollars, we get a federal match, so these numbers will double. We'll designate $159 million to increase reimbursement for Medicaid providers. This is also a priority. We'll designate $31 million to fund tobacco cessation and prevention programs. My proposal pays for all of this by bringing the tobacco tax in line with the national average, from 30 cents a pack to $1.45, just the national average. It's not the highest, it's not the lowest anymore, it's now the average. Smokers cost Virginia's Medicaid program $400 million annually in tobacco-related illnesses, and this is all related to cancers, heart disease, and diabetes. This tax on smokers will pay through my bill, will finally make them responsible for their own health care costs.